Hi everyone, I'm Dr. Lila Abbate and welcome back to my YouTube channel. Today we're going to be discussing Diastasis Recti. And it can also be said Diastasis Recti, so it depends upon what part of the country you're in or if you're Canadian, accents differ. And the reason it's part of the topic of conversation today is because I think a lot of Facebook media, social media has been talking about disruption of the abdominis, the core itself, and where things get torn, especially in postpartum women. So it's been a hot topic, and how do we retrain and rehab the diastasis. So I want to show you first in an anatomy book where it is and what we're talking about. So of course we have the basic idea of the abdominals and the two rectus that come together. It starts with the xiphoid process at the top, which is just under the ribs, and it attaches to the pubic symphysis. And yes, this is a male photo because men and women can both get a diastasis. Typically it's not thought about for men, but it's becoming a little bit more discussed because of the minimally invasive laparoscopic surgeries. So all of these surgeries will create an opening within the umbilical area in order to insert a camera or a tool that the physician and surgeon are using. And yes, they have little laparoscopic holes, and these are minimally invasive, but yet they do disrupt this linea alba. So the linea alba is the connective tissue, that white part in between that connects the two ends. So if I just show you a different point of view, I'm turning the page, and here you're going to be seeing that these are the two rectus abdominis main parts of the muscle, and the connective tissue in the middle is that linea alba. So when that gets torn or overstretched or disrupted, then people can have a tearing, and you can have a space in between. So when the patient lifts their head, they can almost see a bulge coming out of their abdomen. Patients can feel weakness, and it travels into other symptoms. They're looking at urinary incontinence, they're looking at low back pain, and pelvic organ prolapse in women. And a lot of times, we're not thinking, is my low back pain part of the idea of having a diastasis? But when you think about it, if you maybe have had a minimally invasive laparoscopic surgery, that could be part of the reason. So young people are having all of these issues as well. I am a little bit more versed in people who have Crohn's disease, because of some of my family being involved in that. And they have surgeries that are done, and there's 14, 17-year-olds who now have a diastasis, and there's girls that are having urinary leakage when they're doing maybe track events at school or mandatory health class. So I think it's just something to discuss, and there's ways to rehab these muscles. So first of all, you need to figure out from a myofascial perspective, and the fascia is any type of connective tissue that surrounds a muscle, and if that's tight and creating tension, that makes it move away from it being together. So even when I had the pubic symphysis lecture, or I discussed that as a little vlog here, we talked about, okay, so why is not the pubic symphysis coming together? And then they said, you gotta think of it the other way, what's keeping it apart? So kind of the same thing, scar tissue can keep it apart. So then you have to maybe do some myofascial work on your abdomen, and the idea is for you to see a pelvic floor physical therapist, a women's health therapist, or even an orthopedic therapist in your neighborhood if you don't have access to a women's health therapist. And the idea of just strengthening, what will create these ends to come together? So a head lift, which would be like a curl, abdominal curl, can create the ends to come together. But then there's safer ways to do that. So of course you want to maybe elevate your butt if you're a woman and you have pelvic organ prolapse. But the idea of creating tension to bring the ends together is a good way to train. And the take-home message really is, if you've had a baby, if you've had an abdominal surgery, and you think that scar tissue is getting in the way, and you feel like you're not strong, and then all of a sudden, a year out, you have maybe urinary leakage or low back pain that you can't control, you may want to be evaluated for a diastasis and to see how that can help correct it with physical therapy. So I hope that was informative, and see you again soon. Bye.